have two classes today. First one is Adolescent'S Health, and second one Youth's Health. I think that we have class until 12 o'clock, 11 o'clock to 12 o'clock. And between classes, we have a break time. For example, 30 minutes or 15 minutes. The class is about Adolescent'S Health. My name is Adolescent'S and I'm family medicine physician, assistant professor of family medicine, Tehran University of Medical Sciences. As you can see in this slide, WHO defines adolescents, youth, and young people in three groups. It's adolescents as individuals in the 10 to 19 years age group. Youth is 15 to 24, and young people covers the age range 10 to 24. And we have a subclasses that I showed you, but you know that adolescence is the phase of life between childhood and adults. And it is very important time because we have developmental, neurodevelopmental, physical developmental in this phase. It is a unique stage because the human develop an important time for having a good health in adults and in old phase. Adolescents are not just teenagers. In this slide, you can see that adolescents have early adolescents, middle adolescents, late adolescents, youth, and young people. Adolescents and young adults include 10 to 24 years and in three developmental stages: early adolescents, middle adolescents, later adolescents, and young adults. Despite being taught at a healthy stage of life, but you can see that many morbidity and mortality in this phase. Much of this is preventable and treatable, such as drawing, such as roid injuries, such as diarrheal disease, and some events, for example, intentional injuries such as homicides, such as suicides, and reproductive health issues such as unintentional pregnancy and STD maybe occur in this phase, maybe they occur in this stage of life. But you can see that the major morbidity is obesity that can make diabetes mellitus, hypertension, metabolic syndrome. When these adults, when they go to adult phase, maybe these diseases appear because of the obesity in the adolescence phase. And it is important that tobacco use, alcohol use maybe causes harm during the teen years and can lead to nicotine addiction, alcohol addiction, and life, and make major morbidity and mortality later in the life. And the common morbidity can you see in this slide in all groups, in all sex, male and female, is childhood behavior disorders. It means that the childhood behavior disorders is a major and is a common morbidity and mortality that is preventable. We can prevent it, and it is very, very important in the adolescence phase and in adolescence stage. Here is childhood behavioral disorder, here is childhood behavior disorder and depressive disorder, anxiety disorder, depressive disorder, and anxiety disorder, and migraine that correlates to behavioral disorder too. And it is very, very important because it is preventable. The order of many changes appear to be universal. Timing and speed of change is vary among person to person, but it occurs. But all people go through adolescence fast, but maybe it is the timing and speed of change is different from person to person and individually. And both of characteristics of an individual, sex, external disorders, internal factors and external factors can influence these changes. And in this slide, you can see the main factors can be responsible for these differences in the timing and result of adolescence physical changes, such as genes, diet, nutrition, exercise before and after adolescence, chronic illness, substance use, and developmental in other areas. For example, diet and nutrition is very important things. Overweight females, for example, are more likely to have their first period and experience brain development at a younger age than their peers. It is very important for us, for our doctors, when we want to consult to the patients, when we want to consult to the family of the girls or boys where they are in the developmental stage. For example, one mother comes to you and says, for example, I think my child is going to adolescence development. Please help me if you can delay it, or I think that it is delayed and you can fast it. And these is very, very important things. For example, genes is very, very important. A person's genetic makeup can affect the timing of puberty and what the changes look like. Or for example, chronic illness, conditions such as cystic fibrosis, asthma, diabetes mellitus, and bowel problems can contribute to delays in growth and puberty because of the nutrition deficiency, toxin excess, and more medication side effects. For example, maybe a boy have a diabetes mellitus type 1 and they take an insulin, and because of this or because of the nutrition deficiency, maybe the puberty is delayed. And substance use, smoking and using other drugs, alcohol or cigar, or smoking or using or drugs harm adolescents' growth and development. Smoking can shut lung growth and make it harder to grow strong bones, and it affects on skeletal, musculoskeletal, and the body of the adolescents. And development in other areas, I told. The change can occur both inside and outside the body during the adolescence. Happens a process called puberty. You can see in this slide the puberty development in men and in women. And the change, for example, growth spurts in height, or for example, growth of pubic or underarm hair, or skin changes, or male experience deepening voice, and the muscles may be heavier and stronger, and the facial hair, or for example, female experience breast development or being menstruation. And pubertal change maybe happen, and because of the hormones, testosterone for males and estrogen for females. And this slide is very, very important because sequences of pubertal events in girls and boys. This slide shows you these sequences. This is for boys and this is for girls. The first sign of puberty in the boys, what is this? The first signs of puberty in the boys. You can read the age, year, age 9, 10, 11, 12, 13, 14, 15, 16, 17.
Testicular
and these are the change that they occur in development testicular volume. It means that if you visited a boy and you see that that boy have pubic hairs but not testicular volume, it is not okay. Something is wrong here. And this slide is very, very important when you want to evaluate the boy development, the boy sexual development, the boy puberty development. This is very, very important when you want to discuss and consult the parents and family of that child. And the first, as you can see in this slide, the first is increase in growth of testes and scrotum, reddening and wrinkling of the scrotal skin. Pubic hairs appears 6 months after the development of testicular volume, and then followed by phallic enlargement in 12 to 18 months, and peak high velocity, it means that high spurt that we talk about it, and the peak high velocity of 2 to 2.5 years after testicular enlargement. And the axillary hair, can you see the axillary hair here for the developmental puberty or the developmental sexual? Do you see axillary hair? Where is axillary? No. Axillary hair growing is not the developmental of puberty. It is not important for us to evaluate the puberty and to evaluate the sexual development. And axillary hair usually appears 2 years after the beginning of pubic hair growth, but it is considered variably, and it is not important us for evaluate the sexual development. Okay, and about the girls. And this is the testicular volume that I told you. It is the beginning phase of puberty in boys and in girls.
Ma'am, what is mean by the height spurt?
I'll tell you. In another slide, I tell you what is this.
And what is Tanner stage?
Which one?
Tanner stage.
Tanner stage. The breast development has a staging. One stage is Tanner stage. The first breast changing is a Tanner stage. They have 3 stages. That is right, Tanner stage. The first change in breast. Okay, go to the slide for women, for girls. In girls, the breast bud is the first change in developmental, sexual developmental. The first change is in breast. The breast bud formation is the first change for girls. And the pubertal growth spurt typically occurs concurrently and peaking at stage 3 breast, the pubic hair appear. It is the first breast, second pubic hair. And this is the height spurt, and this is the menarche, the first menstruation for girl. Yes. It means that in sexual development, we haven't the menarche at the first time. We have breast, and if this is changed, it is not in good situation. It must to evaluate. It must to we should to evaluate it why it changed. Yes. Okay. And after the breast bud, we have pubic hair and we have height spurt too.
Ma'am, the adolescent time for girls and boys are same or different? 10 to 19, or it is different?
In version, in what? Different in?
You said that we divide the time 10 year to 19 years adolescent time.
Yes.
So it is for both girls and boys, or it is different in girls and boys?
متوجه نمیشم یعنی اگه تو ترنسلیت کنم
He's saying about the age.
Age.
All start at the same age or adolescence starts at different age for men.
For the start of the, I tell you, the time is important because we have the delayed puberty and we have precocious puberty, and it is important. I tell you what age is important for us. I tell you, and this is the physical growth spurt. Physical growth spurt. That is here. Height spurt. Physical growth spurt. Physical growth spurt is the adolescent's experience and overall physical growth spurt. The growth process from the externals toward the torso. It means that it refers a distal proximal development. It means that first the hands grow, then the arms, the finally is torso. First the arms, hands, and then torso. It says physical growth spurt. You can see in this slide that the physical growth spurt in girls is earlier than boys, and the boys is very higher than girls. And we look this in the population that the boys is tall, but girls is not. And because of these spurs, growth spurs, and it is the normal growth development for people.
Then this growth in height or just the growth in this extremities?
First the growth is for extremities and then the torso. First extremities and the torso, and all of them is height spurs,
Yes.
physical height spurs.
According to your last slide, the maximum height spurt is at the age of 14.
The maximum for girls and boys height spurs in girls is 12 years old, 13 years old, and for boys is
16.
14.
here. 15, 16.
So the slide, what do you mean by the first of all there is elevation then depression? What do you
No.
mean?
Here is for girls, here average, and for boys here average. Like that's not, it's not difference.
There is one peak,
No,
right?
his question actually is that are they getting shorter? That's why the
Yes,
coming down.
yes, because this data slide wants to show you the difference of all of the points, and this slide just wants to show you the height. That's this physical
Velocity
growth.
of growth.
Yes. And after these physical growth spurts occur, overall results in 10 to 11 inches of added height and 50 to 55 pounds of increase in weight. First, extremities, then torso, and at the end of this development, taller and the increase in weight. Okay? And what is puberty? For girls, puberty starts at 8 years. Before it is not okay, and after the time that I tell you, it is not okay too. The puberty is a rapid growth spurt that we talk about it, starting around age 10, lasts for a few years, and then girls continue to grow more slowly until they are 17 or 18. It means that puberty for girls ends at 17 or 18 years old for girls. It is end. And during this time, breast blood development, pubic hair appearance, height increases, menstruation begins, and hips widen. All the changes that it makes women
Sign of puberty.
Makes them ready for pregnancy and for menstruation and like this. And for boys, usually begin their growth spurt 1-2 years after most girls, we show it, and continue to develop for 3 or 4 years after the girls. Which means boys may not finish growing physically until they are 21. It means that if the development, sexual development of boys is not okay and it has a problem, we have a time until 21 years old. But for girls, we haven't time, just because the end of the developmental of sexual is 17 to 18. But for boys, we have time, and they are 21. During the puberty, pubic hair appears, the penis gets longer, height increases, the voice deepens, and muscle mass develops. Okay, that is the exactly time that we, as I told you, that the boys usually begin their growth here. This one. First we talk about this one and then go to that slide. We have a title that precocious puberty. In boys, when testicular and penile enlargement and genital or body and facial hair grow during before the age of 9 is precocious puberty. بلوغ زودرس. Earlier. And in girls, when the breast development, onset of menstruation, and pubic or underarm hair growth before age of 8, it is not normal. It is a problem when in boys before 9 and in girls before 8. And at the end size, in girls develop after 12 to 16 years, and in boys after 13 to 14 years. It is delayed puberty, بلوغ دیررس. And it is important and it is problem again, and we want to evaluate it. And the causes of delayed puberty, growth pattern with the family, genetics, medical condition, such as hormone, for example, GnRH hormone, eating disorder, hypothalamus defects, problem with the pituitary or thyroid gland, chromosome regulations, or girls who are extremely active in sports. It can cause, these are the causes of delayed puberty. And this is precocious puberty. Okay, these are the physical developments. Physical development that changes in the body. The changes that you can see them. You can see the increase in height. You can see the deepening the voice. You can see the hair on the face. Now I want you search yourself about how can we supporting. You search the supporting way that we can do, and we can consult to the parents of these children that they have a good sexual development. I show you this slides about how can do it. But first I want yourself search it, and then we talk about these supporting ways that we can consult the parents, and we can support these ways that they children have a better and good development sexual in their adolescence phase. Okay. Search it for 15 minutes. Going through is normal. encourage adolescents to have a positive view of their bodies because of these changes that occur, help adolescents eat well because the nutrition has has important effects on the sexual developmental, and get active with adolescents activity, and teach adolescents to avoid drugs, smoking, tobacco or alcohol and like these, and make sure adolescents get enough sleep because sleep is very important in sexual development, and show adolescents how to discuss and maintain their health. And all of this advice have a guideline in all countries. For example, in Iran, in India, in Pakistan, there is a guideline. It's a pocket, it's a booklet that we can advise it to the people, that they read it and they have a better life and better development, sexual development. The doctor is not, the work of doctor is not just medically. Maybe a parent come to you and they consult with you. Maybe you should educate their parents and educate the children. And knowing of these things and these ways and this supporting this is important for a doctor to get better advice, to get a better educational advice, and make people healthy. Okay, we want to talk about another development. It is cognitive development during adolescence. Cognitive development refers to a change in brain that prepare people to think and learn. And these developments, cognitive development, it occurs in developmental, in adolescence phase of our life. And just as in early childhood, adolescents' brains undergo a lot of growth and development. The changes is growing new brain cells. Adolescence is one of the few times in which the brain produces many cells at a very fast rate. And in fact, the brain creates many more cells than will be needed. The extra brain cells give adolescents more places to store information, which helps them learn new skills. And in adolescence, it's very good phase of our life to get new skills, to learn new skills. Pruning some of the extra growth. It is a disadvantage of the extra brain cells that decrease the brain efficacy. As adolescents go to school, live and work, the brain trims down the extra growth based on the parts of the brain the adolescent actively use. This pruning process creates a brain structure that enables adolescents to easily access the information they use most. It means that because of this pruning, just important memory, the important information processes creates a brain structure that enable adolescents to easily access the information they use most. And a strengthening connection, it happens by the cells, fatty tissue cells. It says the connection between brain cells are what enable the information stored in the brain to be used in daily life. The brain strengthens this connection by wrapping especially fatty tissue around the cells to protect and insulate them. These changes help adolescents recall information and use it efficiently. These changes will reinforce adolescents' ability to make and carry out decisions that will help them thrive now and in the future. The brain grows and strengthens itself is in 3 ways. Okay?
Hanam, why the growth of extra brain cell it is harmful? It decreases the brain's efficiency. Why does it happen?
The growing new brain cells, because
extra.
when the number of the growing brain cells is a lot, the stimulation and the events that occurring the teenager and the people cannot get all the information or inform them, and because of this the brain needs the chronic some of this extra growth to the people can enable information they use most. Do you understand? Because a lot of this, we cannot analyze all of these events in our mind. We cannot use the important things. For example, myself is active in another work, and now I want to focus in the class and I want to talk. And because of that activity occurs, I cannot do my perfect activity in the class. And because of this, it is better that chronicling some of the extra growth and to able to they use most the information that they use most they can use in their life. Yes. And adolescence is an ideal time in person's life to gain and maintain new skills, and the changes in the brain and how they shape a young person's thinking help prepare adolescents for adult decision making. Yes? For adult decision making, either adult fathers after marriage, after they have children, after they have a work, and they're ready for this decision making, problem solving. Another change in the adolescent's life is emotional development. This picture is the limbic system. The limbic system is linked to the hormonal change that occur during puberty, and it develops years ahead of the front part of the brain, the frontal cortex. Puberty hormones target the amygdala here, part of the limbic system directly, and powerful sensation become compelling. This hormonal change and the early development of the limbic system related to novelty seeking, regulating emotion, determining rewards and punishments, and processing emotional experiences. These are the emotional development during adolescence because of the hormonal and the effect of hormonal on this limbic system, hypothalamus, amygdala, and hippocampus. And this place is very, very important for these emotional developments in the adolescence. And because of this, changing levels of neurotransmitter dopamine and serotonin in the limbic system can make adolescents more emotional and more responsive to rewards and stress compared to when they were younger. When you reward adolescents, they're very, very happy. Yes? Or when you punish them, they were sad. Yes? Because of this neurotransmitter, because of these changes. Because the dopamine and serotonin affect on that system, limbic system, that's what I told you. Dopamine is a neurotransmitter in the brain associated with pleasure and attaching to the environment during decision making, while serotonin, the calming chemical, eases tension and stress. During adolescence, dopamine levels in the limbic system increase, and input of dopamine to the prefrontal cortex increases. This increases dopamine activity may have implications for adolescent risk-taking and volunteering to boredom. They do risky activity, yes, in the adolescence, maybe driving very fast, high speed, and use tobacco, smoking, alcohol, and because of these change in neurotransmitter and because the effect of neurotransmitter in the limbic system. Serotonin also puts a brake on the excitement and sometimes recklessness that dopamine can produce. If there is a deficit in the serotonin processing in the brain, it neuroscience, and like this is the violent behavior can result if the dopamine and serotonin
Imbalance.
yes, imbalance, and it is not good for us to that adults. This is the prefrontal lobe that this neurotransmitter affected. The prefrontal cortex is one of the last brain regions to mature. It is the last part of the brain, and because this part of the brain responsible for planning, prioritizing, controlling impulse, and it is still maturing into early adulthood. It is the last part when they want to planning, when they want to controlling impulses, and the last late adulthood, early adulthood, and late part of the adolescence, it is developed. We have another developmental, that name is social developmental. Social developmental, it is building new connection and establishing identities outside of the context of the family. Is a normal part of healthy development. Interacting with people outside of the family circle can teach adolescents how to maintain healthy relationships in different contexts and identify roles they can play in the broader community. Still, adolescents will need support as they experience these new roles. Engaging in role-playing and learning strategies modeled by peer and adult mentors may help adolescents practice cooperating, communication, problem-solving, and decision-making skills, as well as tactics to resist peer pressure. And in social developmental, we have two items: expanding their social circles and expanding their social groups. And these two topics are occurred in social developmental during adolescence. And the last developmental is moral developmental during adolescence. Adolescence is a time when change in the brain encourages young people to think about the world more deeply and in a more abstract way. This thinking helps shape how adolescents see the world, how they choose to interact with it, and how they begin to develop the morals and values that will play out in their adult lives. We talked about adolescence thoughts. We talked about 4 developmental. Can you number it for me? The developmental. We talk about
Stages. Puberty.
no. The developmental. Puberty is in physical developmental.
Emotional development.
Sexual, social,
Sexual is in physical development.
cognitive,
Social, physical,
emotional,
moral, and
emotional.
cognitive development. Yes? Review it. Just again. The first one is physical development, sexual development, puberty is the sub groups of these developmental, physical development. And the second one is
Cognitive.
the second was cognitive development, to think and learn. The third one is emotional development, the effect of neurotransmitter on the limbic system, on the prefrontal cortex, and the social development, and the last one is moral development. These are the developments that occurs in adolescence phase. And we talk about the puberty and the time of this adolescence. Adolescence time is 10 to 19 years. Okay. Do you like game?
Yes.
Yes.
Yes, do you like game? We have a game and settle. The group divided to 3 people and do these. After do this game and we talk about the answers, then we have a break time, okay? What's the first question? The first sign of puberty, girl?
Yes.
And precocious puberty is penile enlargement before the age?
9.
At the 15 to 24 years age group.
Youth.
The factors responsible for differences in time of physical changes in adults?
Smoking.
Smoking, genetics, chronic disorder, unlikely, and here is smoking. True answer. Which of begin the growth spurt earlier, girls or boys?
Girls.
Yes. And increase this neurotransmitter, make risky behavior during adulthood.
Dopamine.
And what is the opposite neurotransmitter?
Serotonin.